Safely delivering lung radiosurgery presents considerable challenges given continuous respiratory-induced motion and significant surrounding healthy tissue. As a proven solution for treating medically inoperable lung cancer patients and those seeking an alternative to surgery, the CyberKnife robotic radiosurgery system stands alone in addressing these challenges, setting new standards for accuracy, conformality, and respiratory motion tracking. Beginning with treatment planning, the CyberKnife's multi-plan treatment planning system intelligently and easily enables the development of complex treatment plans designed specifically for the unique needs of lung radiosurgery. With a multi-plan system, even the most sophisticated treatment plans can be easily developed in only a fraction of the time that is commonplace with gantry-based treatment planning systems. Often considered the gold standard dose calculation when treating lung cancer, the CyberKnife's Monte Carlo dose calculation produces results in minutes compared to what typically requires hours or days with other systems. And using true 4D treatment planning capabilities, the CyberKnife can account for tumor and surrounding structure motion and deformation throughout the entire breathing cycle. Using two fixed low-energy KV image sources, an orthogonal image pair is captured by two high-resolution floor-mounted image detectors. Referencing DRRs generated from the planning CT, the CyberKnife system overlays live images to automatically and rapidly align the patient. To address the risk of intrafraction tumor movements, the CyberKnife system utilizes continual image guidance throughout the treatment to recognize even the slightest translational or rotational shifts that might occur. With the unique ability to recognize intrafraction motion, the CyberKnife automatically and seamlessly corrects beam delivery throughout the treatment without requiring clinician intervention, treatment delay, or manually repositioning the patient. Conventional technologies such as IGRT and cone beam CT only provide image guidance for pre-treatment setup. Therefore, patient and target movements during treatment delivery often remain unrecognized. This may result in an increased risk of underdosing the tumor and added toxicity to surrounding sensitive structures. Safely delivering lung radiosurgery presents considerable challenges given continuous respiratory-induced motion and significant surrounding healthy tissue. Gantry-based techniques, such as arcing IMRT, often treat the target's entire range of motion and cover extensive healthy tissue with potentially harmful high doses of radiation. Other gantry-based techniques, such as respiratory gating and breath holding, have been developed to minimize healthy tissue exposure and toxicity. However, well-documented inaccuracies with such gantry-based techniques require large planning margins and are often suboptimal when delivering the high doses required for lung radiosurgery. Using the Synchrony respiratory tracking system, the CyberKnife delivers tightly contoured beams that move precisely with 3D tumor motion throughout the respiratory cycle. With this revolutionary technique, patients breathe freely during treatment without gating or breath holding, and planning margins are limited to only that which are clinically relevant. With the Synchrony system, the CyberKnife maximizes surrounding tissue preservation, with planning margins that are often only 1 millimeter, not centimeter, but millimeter. In contrast, gantry-based techniques require large planning margins, often adding 1 to 2 centimeters or more of healthy tissue coverage beyond the defined clinical margins. And with the sophisticated image processing techniques available with the Xsight lung tracking system, select lung tumors no longer require implanted fiducials. With Xsight, many lung cancer patients can now be treated completely non-invasively. With radiosurgical dosing, preserving surrounding healthy tissue is critical. More than 30 years of high-dose hypofractionation studies have proven that non-coplanar treatment delivery is essential to delivering maximum dose conformality with a combined steep dose gradient. With a CyberKnife system, this proven radiosurgical approach for tissue sparing is extended to treat targets such as the lung. With full 6D robotic mobility, The CyberKnife automatically delivers hundreds of uniquely angled, non-coplanar beams in routine clinical practice, without clinicians having to enter the treatment room or manually rotate the couch. Gantry-based systems, which are constrained to clockwise, counterclockwise rotations, typically only deliver 5 to 7 beams or a single arc over an axial plane. While this may be a suitable approach for low-dose radiotherapy, it is often not well suited for lung radiosurgery, since extremely high doses are focused to very limited beam entrance and exit points. Intricate dose sculpting often requires the use of multiple collimators. The new IRIS variable aperture collimator makes multiple collimator treatments practical for routine daily use. Using tungsten segments to rapidly manipulate beam geometry, IRIS can deliver multiple-sized beams from each LINAC position. With beam characteristics virtually identical to that of fixed collimators, IRIS enables highly conformal multiple collimator treatments that have proven to reduce treatment times as well as reduce the total dose delivered to the patient. Incorporating all of the latest advancements, a typical CyberKnife lung case requires approximately 25 to 55 minutes door-to-door per fraction. With only 3 to 4 fractions on average for lung radiosurgery, the time for the entire regimen requires approximately 2.5 hours to complete. With treatment times comparable to that of published gantry-based lung SBRT studies, the CyberKnife system sets itself apart from gantry-based technologies by ultimately providing superior healthy tissue avoidance with dramatically reduced planning margins. In conclusion, safely delivering lung radiosurgery presents considerable challenges given continuous respiratory-induced motion and significant surrounding healthy tissue. With real-time respiratory motion tracking combined with routine non-coplanar beam delivery, the CyberKnife has set new standards for targeting accuracy, dose conformality, and healthy tissue preservation. The CyberKnife Robotic Radiosurgery System. Unprecedented targeting accuracy, delivered anywhere in the body.